University School of Medicine. Today we're here to talk about bloodborne pathogens and how to protect ourselves in the workplace from the dangerous diseases they can cause. Let's start with some definitions. Pathogens are microscopic agents that cause disease. Bloodborne means they are carried in the human bloodstream. Other potentially infectious material, also known as OPIM, is any body fluid that is contaminated with blood or has the potential of carrying these pathogens. Now, it must be treated as a health risk in the same way as blood. In today's workplaces, the bloodborne pathogens and diseases that cause the most concern are hepatitis B, also referred to as HBV, hepatitis C, known as HCV, and human immunodeficiency virus, known as HIV. HIV is the cause or the precursor to acquired immune deficiency syndrome, commonly known as AIDS. This illness interferes with the immune system, making people with AIDS much more likely to get life-threatening infections or cancers that a healthy immune system would be able to fight off. Hepatitis B and C are viruses that attack the liver, and they cause long-term health problems that include chronic inflammation and even liver cancer. Severe cases can result in liver failure and death. Now, while you can't get these diseases from casual contact, they are serious diseases that require serious precautions, especially in workplace settings where it can be reasonably anticipated that exposure could occur. Of these illnesses, hepatitis B is significantly more contagious than the other two. The virus itself is hardier and longer lived, while the other two viruses don't stay alive for very long outside the bloodstream. Hepatitis B has been found to survive for more than a week in dried blood or on contaminated surfaces. What this means is that workers can still be exposed to this virus long after the infected person has left the workplace if countertops, chairs, or other equipment are not properly disinfected. Fortunately, there is a vaccine that provides significant protection from hepatitis B, and we'll talk more about that in a few minutes. When discussing all types of bloodborne pathogens, you should be aware that infected individuals often don't know they are carriers. They might look and feel healthy, even though they can still spread the pathogen and may eventually develop serious illnesses themselves sometime in the future. In fact, the majority of people infected by bloodborne pathogens do not have any symptoms at all in the early stages. Symptoms may take months or even years to develop after exposure. If they do appear, symptoms of these diseases can often be very similar to the flu and may not raise an immediate alarm. Often a blood test is the only way to determine whether a pathogen is present or not. But now for some good news. There are steps that you can take to control occupational exposures to bloodborne pathogens. As I mentioned before, these diseases are not spread easily through casual contact, such as shaking hands or sharing eating utensils. Instead, bloodborne diseases require infected blood or bodily fluids to enter a healthy person's bloodstream. For example, through hypodermic needles, or through non-intact skin, or through mucous membranes. That's why these illnesses are most commonly spread through intimate sexual contact or through intravenous drug abuse. However, infection and even deaths have occurred as a result of workplace exposures. Workplace hazards include accidental needle sticks or other so-called sharps injuries, or splashes of infected material getting into the eyes, nose, or mouth. In order to protect yourself, it is critically important to follow safety precautions and know your organization's exposure control policies, equipment, and processes. Now let's take a moment and talk about sharps. This is a term used for hypodermic needles or any other tool or object with a sharp edge that could introduce infected blood or other material into the bloodstream. Hospitals, clinics, and similar locations will keep sharps disposal containers nearby for safely throwing away used needles and other sharps. A sharps disposal container must be closable, puncture resistant, leak proof, and labeled. While sharps might be an expected and routine part of some workplaces, it is still possible to come across contaminated sharps in other settings as well. For example, due to drug use, needles can be carelessly discarded in public trash containers or restrooms germs or just about any other place. If you come across a needle or other sharp, assume that the sharp is contaminated, since there's really no way to be sure that it isn't. Be very cautious, get help, or use cut or puncture-resistant gloves. Wash your hands immediately after removing the gloves. Even better, use a tool rather than your hands to handle sharps whenever possible. Also, watch out for cross-contamination. Now, this is when a contaminated object touches another object or surface, leaving behind the germs. For example, touching work surfaces or other equipment while wearing contaminated gloves. Now here's another definition that you should know. Universal precautions, also known as the universal standard, which means that you should treat any blood or other potentially infectious material as if it were infectious. Now, since it's so difficult to know who is a carrier of these diseases, the only safe alternative is to use precautions in every case. Regardless of the efforts your employer has gone through to make your workplace safe, it's still your responsibility to follow proper procedures and use care in the presence of potentially infectious material. Be alert for tasks or situations that may put you at risk. Learn about the controls for reducing exposure in your workplace, but also be aware of the limitations of these controls. Work practice controls are procedures and methods for doing your work that minimize exposure and risk. An example would be dumping laundry or trash out of bins instead of reaching into them in order to prevent injury from improperly discarded sharps. Some work practice controls may seem a bit cumbersome or add to the time it takes to do any particular task, but they should become second nature nonetheless. They are critically important considering the risk of exposure from working hastily or carelessly. Of course, some of these precautions involve basic hygiene and common sense. It's obvious you shouldn't smoke or eat or drink, apply cosmetics, or handle contact lenses in work areas where you could be exposed to bloodborne pathogens. Other precautions include visual signs that communicate hazards. Warning labels are red or orange-red and feature the universal biohazard symbol. Bags for potentially contaminated materials must also be red or orange-red. It's especially important to handle and dispose sharps in a safe manner. Do not try to bend, break, or recap these needles. Keep sharps disposal containers as close to your work area as possible. Engineering controls are physical protections that create a barrier between your bloodstream and potentially infectious material. Engineering controls include sharps disposal containers, special devices with built-in safety features, and personal protective equipment or PPE. Personal protective equipment is provided by your employer where appropriate to protect you from workplace injury, including the risk of infection by bloodborne pathogens in workplaces where potential exposure might be expected. PPE can include glove, face shield, or masks and eye protection, as well as aprons, disposable booties, and other protective clothing. Keep in mind that PPE can only protect you if you use it properly. For example, gloves that are torn or punctured or contaminated should not be used. And even without visible defects, gloves may not completely protect you. So use them with care and wash your hands before and after using them to eliminate pathogens. After using disposable gloves, discard them. They are not designed for reuse. However, non-disposable utility gloves may be reused after decontamination as long as they don't show any signs of wear. Use face and eye protection where splashes or droplets of blood or OPIM could enter your eyes, nose, or mouth. Prevent cross-contamination by carefully removing soiled PPE before leaving the work area and either decontaminate or dispose of it properly. But what if an emergency involving another person creates a potentially hazardous situation? This could happen in just about any workplace. Say a coworker gets hurt and is bleeding. You need to act quickly to help your coworker, but this does not mean you are expected to put yourself at risk. Sure, some situations may call for heroic acts, and instinct can take over if a life-threatening situation is involved. But in most cases, you can act quickly while still following safe procedures that protect you, even as you're helping your coworker. While it's beyond the scope of this program to teach you first aid, here are some steps for protecting yourself from bloodborne diseases during an emergency situation. If the situation is serious and coworkers are nearby, call out for someone to get medical help or dial 911. Put on the gloves in your first aid kit. If the injured person is thrashing around, or if there's any chance that blood or other fluids could splash in your face, put on a mask to cover your mouth and nose, and goggles as well. Apply first aid and do the best you can to stabilize your coworker until help arrives. After the situation is resolved, you still need to take precautions. If your clothing or shoes are soiled with potential contaminants, remove them carefully, avoiding cross-contamination with your clean clothes or other surfaces. Place those soiled or contaminated items in a red bag or other marked container as hazardous waste. Wash your hands immediately after removing the gloves. Antiseptic gels are only a temporary substitute. You should still use soap and water thoroughly as soon as possible. Wash your face carefully too if there's any chance that contaminated materials have splashed there. If blood or potentially infectious material has spilled on the floor, put on disposable shoe covers before walking into the area to clean. Disinfect surfaces that have been contaminated using an approved disinfectant or fresh 10% bleach solution. Let the disinfectant stand for 10 minutes before rinsing or drying. Currently, there is no vaccine to protect people from hepatitis C virus or HIV. However, a hepatitis B vaccination is available. It is 95% effective and has contributed to a significant decrease in the number of occupational infections due to its use. In many industries, employers are required to offer hepatitis B vaccines free of charge to their employees. An employee may decline to receive the vaccination, but he or she must sign a declination form if that is their choice. Now remember, a person who is infected by hepatitis B can remain symptom-free for months after exposure, and almost 1/3 of people who are infected never get any symptoms at all. People who look and feel healthy can still spread the virus and may eventually develop liver damage, cancer, or liver failure themselves. Due to the serious nature of this disease, an employee who initially declines to receive the vaccination may reconsider at any time and accept the employer-provided vaccine. An exposure incident is an eye, nose, mouth, non-intact skin, or mucous membrane contact with blood, or OPIM. If you are exposed, immediately wash with soap and water, or flush your eyes, nose, or mouth with water or a sterile solution. Now, such an incident is by nature unfortunate and unexpected. Therefore, it's important to know up front your employer's policies concerning what you should do and who you should contact. Know how to report an incident and understand your employer's record-keeping requirements. Report the incident right away and get emergency medical help, within 1 hour if possible. If you were injured by a needle stick, note down the type and brand of the needle, or retain the needle if this can be done safely. In general, you can expect that evaluation by a medical professional and follow-up care will be provided to you by your employer. The evaluator will document how the exposure occurred and the circumstances surrounding the incident. The source individual should be tested for hepatitis and HIV, with or without consent, depending on the laws in your location. With your consent, your blood should also be tested. Your employer will offer post-exposure care along with counseling and evaluation should you become ill. Your diagnosis will remain confidential, but the medical practitioner handling the evaluation and follow-up will provide a limited written opinion to your employer. Now let's review what we've gone over here today. Bloodborne pathogens cause diseases that are carried in the human bloodstream. While you can't get these diseases from casual contact, they can be spread by infected blood or other bodily fluids coming in contact with your blood or mucous membrane. These are serious diseases, and precautions must be taken to protect employees in workplaces where exposure could occur. The risk of occupational exposure can be reduced by adoption of the universal standard, by which we mean assuming all bodily fluids are contaminated, by use of engineering controls, such as physical protection, and workplace practice controls. These are procedures for doing your work that minimize Depending on the industry, your employer may provide containers or biohazard labels for contaminated materials and personal protective equipment to provide a barrier between yourself and potentially hazardous bodily fluids. It is important to follow procedures, as any precaution only works if it's used at all times. If your industry requires it, your employer will offer the hepatitis B vaccine. Now, if you personally are stuck by a needle, or if potentially infectious material contacts your eyes, nose, mouth, or broken skin, here are emergency steps you need to take. Immediately flood with water. Clean any wound with a skin disinfectant or soap and water. Report to your employer immediately and get immediate medical help. Be sure to get answers. If you have any questions or concerns about bloodborne pathogens, you can check with your local health department to find out about your state and local rules and regulations. Well, that's it for now. I appreciate the opportunity to share this material with you. I hope you found this program to be useful and informative. While we couldn't cover every possible situation, following these general guidelines should make for a safer workplace for yourself